Hello everybody, it's panel time, and today I've got with me Khan again, I've got Jess with me, and I've got Emily with me. I'm going to let everybody introduce themselves, uh, and we're going to have a nice panel, I think, today. Can I say we got asked a question earlier in the morning panel that I got extremely confused about, not because of that, but I thought it was about something else and I didn't answer it. So the first question we actually answer is going to be that one. Anyway, I'll say to Emily, I'll ask her if she can introduce herself.
Thank you. Hi everyone, I'm Emily Gage. I'm a principal clinical psychologist working in the mental health liaison team at the James Padgett Hospital, and I'm also a member of the LGBTQ+ network, staff network of NSFT. Because I work at the Padgett, I also co-chair the James Padgett network, so I have a bit of a crossover between the trusts. I identify as a gay woman, and I'm also a proud parent. So my two children have same-sex parents, and I'm really passionate about parenting rights for the LGBTQ+ community. Thank you.
Next, Khan, can you introduce yourself?
Hi, so I'm Carl Purvis. I'm a Quality, Diversity and Inclusion Lead for Workforce at Norfolk and Suffolk Foundation Trust, and I'm a proud member of the Out and Proud network at NSFT. I'm also a cisgender gay man.
And Jess, could you introduce yourself?
Hello, I'm Jess. I'm an assistant psychologist in Norwich's community mental health team. Yeah, I'm part of the LGBT network, or the Out and Proud network. I identify as bisexual.
And I better introduce myself, I think, because I craftily did not. And I'm getting that lackadaisical at the moment. I keep on just entering these things and just saying, I'm here, worship me almost, but not. I'm Jenny Carlisle. I'm the chair of the LGBT, the Out and Proud staff network group. It's just at the side of me and I should be able to read. I'm a trans woman, and together with the party, well, all the people in the network, we've produced this conference, which I'm really happy about. Before I go to the first question, there was a all the actual things from the conference you can see are being slowly uploaded. These panels will not actually appear until after all the speakers and the presentations have been uploaded, and then we'll be uploading the panels. Adam will be doing this, and I would like to thank Adam for the fact that he's working so hard behind the scenes. I'd like to thank Sammy because she's working so hard behind the scenes, basically producing these, and when we are her guest producers, we are putting ourselves in her hands all the time. So let's actually begin. The first question I've got is a question that was done on the morning panel, and it was basically supplied from Chris, whose pronouns are he, him, and he's basically been about, and they asked about the Out and Proud network. Why is it called the Out and Proud network? The actual decision for it to be the Out and Proud network, I think, was made when Jess was around, when Khan was around, when I was around, and I think Emily was around at that meeting. I'm not 100% sure with Emily, but I know you've got 3 people that were actually involved in this decision. I am quite sure that my memory is so fuzzy that everybody will correct me and say, no, this isn't right. But at the actual time, if I remember, there was a question that half of the LGBT staff did not declare or were not visible, or were visible but did not want to be involved in anything to do. It was a feeling that if you start actually doing things like conferences and things like that, it made their lives hard. Now, the decision about Out and Proud wasn't if you actually join the staff network, you're going to be outed. That was not the actual decision. Your identity was going to be protected. It was just the actual fact that people that were all right with actually being, well, can I say a face, which I presume I am, because if everybody hasn't gathered, I'm a trans woman by now. I presume they're not watching the conference. But so it was people that were all right with it. There was no pressure for there's no pressure actually in the network group for suddenly to run to the actual colleagues and suddenly say, and declare that they were out. The network group itself does not actually out anybody. And the main point of the network group was first and foremost, forget the visibility bit thing, to be a safe space for people that were LGBT, where they could all come along and they could all have their say. I hope I've explained that right. If I'll just actually basically Khan, I think you were at the meeting. Can you follow up on that in case I've been confusing?
Yeah, absolutely. And Jenny, I think you've put it really well already. There are some ways people can take part in works without being sort of really visible or present in meetings where there's going to be other people. So you could join the list. You could then contact the chair discreetly. But I think I remember you also putting this really well at that meeting, that actually the role of the network was to help deliver change. And actually one of the changes was to make people feel that it was okay to be out at work. And I have since then, I think, taken a cue from you I've never actually, within this role at least, made any secret of the fact that I'm a gay man. But I think I've now, it's certainly with events like this, it will disclose where it's relevant to the work we're doing. So I hope that that's actually just something that people are feeling is natural, and it's a way of saying it's okay for you to do that too, and show that actually you can do that and negative consequences won't follow. But of course, people's situations will be different, so that will not actually impact everyone equally. I think it's a case of doing what we can as we can, and trying to generate workplaces that feel really welcoming to the most number of people that we can do.
Jess, wondering if you'd like to actually carry on with this or not.
Yeah, I think I can add I guess a little bit to it, exactly as Khan has said. So I joined this network when I first started working at NSFT. It was one of the first things I did because I knew it had to be there somewhere. So I hadn't yet come out to anyone in my team, nobody knew. And then I think through being part of the network, I wanted to be involved in projects like this, but through being part of the network, I also kind of had this safe space where I could.
Wondering if we've lost Jess at the moment, because she seems to have frozen. I'll just watch what actually happens there. Emily, Emily, while we're waiting to see if Jess comes back, as you've actually as you've stated, you're the co-chair of the James Paget, and so obviously I presume most people know that your LGBT status. How do you find it difficult to be out at work?
Yeah, it's a good question. I think I've probably, if I go back sort of 10 years, I probably found it more difficult. I think actually I came into this role in the last couple of years and was joining the trust new, moving from a different area, so I didn't really know anyone. And actually I think reflecting on this, joining a new team and trust at that time compared to previously, I found it a lot easier. And I think there's different elements to that. I think one bit is how society has changed in that time. And I think the other bit is probably just my own sort of development and feeling more comfortable in myself and my identity. So yeah, I think in general I've found it relative to previous times easier. But I think there's still challenges, and in a way I think it's interesting because I've sometimes thought about this, and I think I sometimes, when I meet new people at work or outside of work, I almost try and get it into the conversation as soon as possible to prevent the awkward things that can come. So I know, like when I started working here, and I think I was talking about picking up my children from nursery or something, and people sort of automatically ask things about your husband or whatever. And so I think, having been through those experiences quite a lot in the past, and when that happens, you almost, I find I almost feel bad for the other person because I'm going to correct them and I don't want them to feel uncomfortable, which sounds bizarre, but that's how I feel. So I think I almost come out deliberately as soon as possible. So say something that discloses that I'm part of the community, like even probably before it would even come up in conversation, just to sort of prevent those awkward moments. So yeah, it's an interesting one. I don't know if other people identify with that at all.
I totally identify with that. Quite honestly, a lot of my job that I do at the moment involves telephone calls, and I've got a bit of a deep voice, and I am misgendered all the time on the telephone. And at one time I used to be saying I've had gender reassignment surgery and all these actual things, and then one day I suddenly thought, because when I said that, I found that people still carried on misgendering me. And so I thought, well, why should I open my mouth? Why should I actually say this? So when they basically say, "Oh, you Jeremy," I basically say my name is Jenny, Jenny, and if they carry on saying, what do you call it, I'll repeat, my name is Jenny, and that. So I do that, and it happens a lot. When I came here, because I found being a trans woman that unfortunately, and they always basically say that when you put in application forms, you've got to put your history. And I worked in another trust, and what I actually learned was, because there was a big discussion in 2001, I think it was, when I went to work there, that I was trans, that whenever I applied to work anywhere else on the actual within the trust, I had to mention the fact that I was trans in the actual the application form. So shortlisting ignores that. It's no longer an actual thing about nobody knows you. It's anonymous. Because if you say you worked on a ward and you name the ward and you say, well, I was trans on that ward, because I'm not going to actually deny that I'm actually trans, then they know who you are. So I found that disconcerting. When I came to NSFT, I had 10 years of basically if I'm not out, if I would move wars, I was always kind of outed anyway. So each time I transferred wars, etc., that because I'd wanted to actually shrivel up and flipping sort of live my life just as a quiet little person with nobody noticing I was trans, and I found I couldn't do that. So when I came here, I was in everybody's face. I was doing guest speaking that I was trans, if you know what I mean. And I'm very much like you, Emily. Before anybody can say anything, it's kind of that mean stare, and I am LGBT, so what are you going to do about it? I'll ask Khan, how did you feel about all this being out?
Yeah, that's a really interesting question, and I think the NHS has been by far the most overwhelmingly positive place to be out at work that I've ever worked in. I've only worked in the NHS for, it's coming up to 6-7 years now. Try getting rid of me. Anyway, what I would say is that in previous roles it's been really different. So it has been really difficult being out at work. I think if I go back to the 2000s, so not into the early part of that decade, but like the later part of that decade, I had experience where you know, I just came out quite naively, and my boss had a bad reaction, kind of told me that it was a you know, the business ran on family values, which was a bit uncomfortable. And I remember opening the post and finding that they'd sent off for, which is my job, and finding out they'd sent off all of this information about discrimination and gay people. And in another role I had, I remember, and this is again, I'm not obsessed with same-sex marriage, honestly, but it was around the time of that, and I remember a boss making comments about which clearly stated that they felt that those relationships were just commercial contracts. And at a Christmas do, same person had said, well, they had asked me in front of this entire group of my colleagues what I thought about George Michael's sex life involving public toilets, and obviously they weren't asking everyone else. So I would say that being out hasn't always been easy, but I think it is definitely getting better. It's what I would say is just recognise people out there who may be listening across the whole east of England, and I do know that that doesn't mean that that's perfectly the same in every team, in every workplace. So you know, I think what we're doing hopefully will move things on slowly, but it is slow. And it will feel very, very slow for some people. So yeah, I think now I'm having a fantastic supportive response. So I think that's a good thing. But yeah, the answer is very mixed as to, is it easy to be out at work? Not always.
Jess, we've actually changed the question while you disappeared for 5 minutes or 3 minutes, or anyway, you're back with us, and we're so eternally grateful for this. So, is it difficult being out at work?
Yeah, so apologies for internet giving up on me. I came into the office because home internet was betraying me, and the office internet did exactly the same thing, but fingers crossed it won't happen again. It's difficult to be out at work, so no one that I have told about my sexual orientation has ever said anything bad to me in the workplace, which I'm really grateful for. But I know that I only tell people when I feel like they're not going to discriminate, or they're going to be okay with that information. So there's kind of this, I've not had any bad feedback, but I know that I'm only telling people, select people who I feel would take it well. I don't think being bisexual and being in what looks like a heterosexual relationship, because I'm in a relationship with a man, it doesn't kind of come up in a way that I can say, oh, I'm gay, because that would probably just confuse people. So it's not something that I'd guess kind of comes up often. But when I tell people I'm part of the LGBT network, I don't necessarily tell them what my sexual orientation is, but then being part of the network kind of is enough for them to know. But I'm quite comfortable with my identity. So if it is something that comes up in conversation, I'm more than happy to say, but that doesn't mean I sent an email to my wider team about this conference, and I stared at that email for a couple of minutes, kind of going, I'm about to out myself to the entire of the team by publicising this conference. Am I okay with that? And I just thought, well, if they're not okay with it, then that's their problem. So I kind of sent it off, and again, I didn't have any negative feedback. People emailed back saying, oh, this looks really interesting. So personally, I've not had any negative incidences or kind of reason to not feel comfortable being out of work. But like I said, I know that I only pick people when I tell them that I know I feel safe with. So there's an element to that.
And relating to the last question also, you were comfortable enough to join the Out and Proud network, and you were not outed. Yeah.
Yeah.
Which is a good actual, to me, it's a good advert to actually come and join us. Yeah. We're secretly not actually plastering people all over screens. In fact, I actually don't hold the meetings at work. I work from home just to do that. Yeah, which has always protected people's privacy. I've got another question. It's an anonymous one, as that one was. I asked this to Dr. Brady earlier, but I would love to hear your answers because you all work in the trust. How do you challenge when we see discrimination when nobody else around us speaks out? I'm just going to give, I think I'm with 3 experts, and then there's me. Yeah, and I work at the moment in a small department. Not that I've never had to actually challenge, but Jess actually did a talk. Was it Jess? I think actually it might have been Madeline that actually said, if you're actually going to challenge, do not get in between somebody and the person that you're being a good ally and challenging for, but stand at the side so you're actually empowering them to speak up as well, which I hadn't thought. To me, this is kind of, in one sense, nobody likes confrontation, whether you're an ally, whether you're an LGBT person, and but it has to be done. But I'm going to actually hand it to somebody else, and then I'll come back and actually carry on. So first and foremost, Jess has just been talking about inclusive language, where she mentioned Lawrence Webb, who worked, can I say, for the LGBT Foundation, who at the moment are doing the assessments for the second part of the badge phase. But they introduced actually a scheme, Pride in Practice, where they went around GP surgeries and actually got them to actually post posters. But Jess, how would you actually answer this person?
I was scared you were going to come to me first. So yeah, obviously I think the talk I just gave on microaggressions, that's kind of more I guess subtle notes of discrimination, kind of comments that potentially aren't appropriate or make people uncomfortable. So I know that it's really difficult when nobody else around you speaks out, but there's probably a chance that other people around you are thinking the same thing as you, but are in that similar boat of I don't know how to go about this, I don't know how I challenge it. So asking the person what do they mean by that is a really is one way to get them to think about the consequences of that comment. What's the impact it's having? Oh, I've lost my train of thought slightly. And then pointing out potentially why that's a really harmful attitude, why that's insensitive, or the kind of negative stereotype that comment is kind of portraying, and why that might not be appropriate. For example, work in a community mental health team, I don't want to see any of my colleagues expressing any forms of discrimination. That's not appropriate when we're a service user facing role. So really kind of thinking about saying, you know, why this isn't an appropriate attitude. It is really important to challenge it when we see it, but I know that it is really hard sometimes. I think Carl might be better placed to know the kind of more process side of it in terms of speaking to kind of managers and HR and freedom to speak up guardians and things.
I am going to come to Con really, and actually seems smiling at me at the moment, and actually probe him about this question. You see, there was a thing that I was just suddenly thinking about recently we did a survey, and one of the things that actually came out about this actual survey was a reference of a doctor behaving badly. That's all I'll say. And I was thinking about, well, at this time I don't work on the wards, and if I actually heard a doctor speak in this way, I'd most probably go for the throat. But then again, I'm kind of very much used to, I mean, I've had 23 years as a qualified nurse, but in my life as a qualified nurse, there's always been in the NHS, and I worked in the army in a different job, but I was all in the hospital hierarchy. In fact, when I worked previously before being a nurse, I was an operating theatre technician, but it was in the days when you had matrons, etc., and everything was hierarchical. And I can see that when people see a doctor who's in a meeting suddenly say something completely discriminating, they'd be worried about will the doctor take it out, interfere with the job, you know, because the actual fact that they can go and have a quiet word and all these things. The only thing that I can actually say is you cannot harass people, you cannot discriminate. Challenge. Do challenge. Because they're becoming part of the problem. But I'll then actually talk to Khan. Khan.
Sorry, my mic was muted there. So what I wanted to capture here is that also I think we all have a scenario in mind that this person's speaking about, and it might not be anything like the one that they're actually in. So this could be that they're seeing discrimination in the way that a service is being provided, and of course you'd need to bear in mind your safeguarding procedures there. There's also DATIX reports, because discrimination is a serious issue. It's not something that, you know, is just a chat between colleagues to remedy. I think there can also be very serious issues in terms of what happens with colleagues potentially. So I don't want to make any assumptions. What I do want to do is to say that the thing that will make the difference is being able to speak to somebody as your first step. So I'm going to pop a link into chat which has all of our contact information for all sorts of issues. And I'm going to speak a little bit about what they are. So there's HR helpline, which could act as a really good source of advice about all of the policies and processes in the trust that might be relevant. And you can have a chat with somebody on that number, a real person, and get some signposting. If you feel really very vulnerable, and for some people that will be true, there is the Freedom to Speak Up Guardian, which Jess has mentioned. And Jess, if you ever want my job, then this is looking quite good, because you're covering most of the things I want to speak about already. But basically, I think that the Freedom to Speak Up Guardian is a really valuable person, and they act as someone you can speak to in complete confidence. So you could do that by just calling them on their mobile number. You could use a mobile. You don't have to give your name or your team if you feel very, very vulnerable. But what we do want is people to get confidence to raise things, because there are processes in every scenario that you can think of that are designed to help. And I just can appreciate that before you have actually done that, it can feel very scary. So please, please, please do speak to someone. That could be to myself. Obviously, and the thing we haven't touched on here is your manager. Your manager is there to support you. And that's a really important conversation to have. So I hope that's helpful. I think there are all kinds of dimensions to this issue that we could discuss. Obviously, our trust, like many others, is engaged in culture work, and it's so important that we're getting to hear these sorts of things from people, so that we can factor that in. And I know for us, psychological safety, and for many other trusts, is a very, very important human resource issue. So thank you for actually bringing this up. I really want to be more helpful. So all I can say at the moment is please, please, please get in touch. And if there's anyone out there listening to this in an organisation external to NSFT, your organisation will have processes as well. I obviously can't signpost you to those, but do check out your own policies. And if you're just not sure where to find anything, speak to your HR team as a first step.
So Emily, how would you challenge basically homophobic or transphobic behaviour?
Yeah, I think a lot of the things have been covered. Thank you guys. In terms of kind of formal discrimination, I think that's really important for people to get an understanding of what that is as well, and seek advice if you need it to understand, you know, is this discrimination? And obviously then there's processes and things to go through. I guess I just wanted to share something a bit different but linked to it in terms of just my experience of challenging comments and things that come up that maybe are sometimes seen as kind of banter, but are homophobic or transphobic, and not necessarily about specific people, but just kind of general comments. And I guess I just wanted to share with everyone that I've actually I have challenged this, and I do whenever it comes up actually, and I've actually had very positive experiences from doing that. I haven't had a negative reaction. I can think of examples. I can think of an example where a healthcare professional, I won't go into details, but a healthcare professional was talking about a service user with the team and using the wrong gender, not to the person themselves, but I challenged that, and I guess I did it in a very much a kind of conversational way, and just kind of explored that with them, and tried to kind of just give a bit of education in terms of why that's important, and why it would be important for the person that the right gender is used, and actually, yeah, that person was really interested and changed their behavior as a result of that conversation. There was no, there was no negativity in it. It was really open, respectful conversation from both sides, and I've had other examples of that. So I guess I just wanted to share that as well, that it can sometimes feel a bit anxiety provoking to challenge colleagues, and things like hierarchy and stuff might come into play, but actually I think a lot of the time people aren't necessarily aware of what they're saying and the impact of it, and are actually quite open to having that conversation and to learning and to changing. So I just wanted to share a bit of a positive experience.
I was going to say something lighter, but it isn't that. What do you call it? I heard somebody in the trust recently making a transphobic remarks about a service user. I hope this event will help educate people, but is the trust going to do more to make this learning mandatory? I can actually say yes, but I'll basically I will pass this over to Khan, because me and Khan have had long conversations about training, and there's quite a bit of training in this actual conference that maybe actually moved out and moved into other training programs. But Khan.
Yeah, thanks, Jenny. I think it's I think training is, and we can see that from comprehensively in national data, still something that will make a positive impact. I think, and I will say just before I move on from that, that of course the next task for our Out and Proud Networks work plan is to put firmer proposals in place for what that looks like, and we're working with clinical services to do that. But I think it's also really important to recognise that this is, really fundamental to what we do. Everyone who works for the NHS should know that making derogatory or abusive comments about anybody, but especially people who are more vulnerable, who are in protected characteristic groups, everyone should know that that is completely unacceptable, and therefore should be completely accountable if they choose to do that. So I would recommend anybody, again, consult your processes, recorded ATICs, because that is incredibly serious. I'm going to put in chat the contact numbers again for anybody that feels that they can't for any reason raise something, and I hope that will cover all scenarios, but I want you to be confident to report what you've seen and experienced and to take that further.
And lastly, just so Jess does not feel completely isolated, I'd actually wonder if Jess has got any comments.
No, not really, in all honesty. Sorry, I don't really have anything to add to that conversation. Sorry.
That's fine. Can I also say that going back to the other question, there needs to be serious discussions on why a person is actually being ignored, as and not being put in a bed that is reflects how they identify. So I've got Emily here, and I'm curious about because Emily basically does my actual kind of work voluntary by being co-chair of the James Padgett LGBT staff network. I'd like to ask Emily how she's found it. What are the highs? What are the lows? Because I've got loads of highs. I've got loads of lows. Yeah, and how it differs from being in a mental health trust to being in a general hospital.
Thanks, Jenny. Yeah, so I guess the Padgett network is newer than the NSFT network. So I started my role in June 2020, and it was just kind of starting then. And soon after I joined the network, the chair was leaving the trust and they were looking for people to step forward. And I guess one of the differences with the Padgett network and the NSFT network, and there's different views on this, is that the Padgett network is for people who identify as LGBTQ+ and allies. However, in our terms of reference, we specify that to take on a role in the network, like being chair or co-chair or something, you have to identify as one of the characteristics. So there was actually there wasn't very many of us in the pool to step forward to be chair. So 2 of us agreed to do it together. I think in terms of the highs, I think just the fact that we've got a network up and running and it's still going, and we're sort of growing gradually is a positive. In terms of the challenges, it kind of links to it really. We're quite a small network, similar to NSFT, I guess, and I really hope that we grow a bit more, partly because just to get the wider representation. So, for example, one of the things we recently were consulted on, the James Padgett Trust were looking at starting to put together ideas for a gender inclusive language policy, and the people in HR working on this came to the network to ask for our consultation, and I really strongly believe in, policies like that being informed by people with lived experience that relates to it. And I think that's one of the reasons I'd really like our network to grow, so that we've got representation from all the different groups, so that we can inform this kind of really important work, because it ended up, some of the stuff that we were advising for the policy related to things like inclusive language for trans people and for non-binary people, and we didn't actually have any representation of those characteristics in our network. So I think one of the things that I reflected on was how wide this network is, LGBTQ plus. There's such different experiences and different different things to consider. So I think that's a challenge. I guess another thing that we're quite proud of, so not on the scale of the event that NSFT have put on, but we've managed to secure some funding for 3 events in our staff canteen next week, where we're just presenting some information about LGBT history, and we've got some funding for some rainbow cupcakes to try and draw people in, which always helps. So yeah, that was a kind of small win. So I think we're getting there. It's the early days. And yeah, for me, I try, as you know, I try and have some involvement with the NSFT network, but it's difficult to sort of have the time to dedicate to both. And I guess because I'm based at the Padgett, the staff that I'm sort of working with on a day-to-day level are here, so I've sort of got more involved there. But as we've discussed, I hope that there'll be opportunities for networks across the region to collaborate as well. And I know the Padgett were really enthusiastic about the programme that you guys have put together, and that's been shared across the trust. So I hope some of my Padgett colleagues will have joined or be catching up on sessions online. So yeah, I suppose that's a brief summary of where we're at, and the positives and the challenges so far.
I take me hat off. If I wore a hat, I don't. I wear a beanie occasionally, but there's nothing better than actually collaboration. I do know that at the start of this, I feel this conference was the start of NSFT staff network being treated and taken seriously. The year before, I think we just did pen descriptions, and I think only 2 went out to actually celebrate our LGBT History Month. And the year before that, quite honestly, I don't think we did anything. And it's kind of taking off slowly, but like you say, Emily, it's an uphill struggle, unfortunately. And you've got to do it, and people come and go, which is also quite frustrating. You have a few people, you have people in key jobs, etc., and then the next minute you look round, they've left the trust. So within that way, not that I'm actually mourning, because NSFT at the moment, I think, is at a good setting. I mean, we've actually done the showy bit, and now I think that when this finishes, I am going to let Emily add something just before I'll just say what I'm saying, and then I'll let Emily speak because she's raring to go. We feel we've got, with how well this event's going, we feel that we can then start to actually look at problems that we face to push forward. Anyway, Emily.
Thank you. Yeah, sorry, no, it's funny how things just kind of come to you a bit later and you
Yeah.
think about the question. Yeah, I just wanted to add actually something that I have been reflecting on in terms of working with the Paget network, but I think is also evident for the NSFT network, is the importance of the support of the trust and the organisation, and I think that's improving in both trusts from what I've observed. So yeah, just the things like securing some funds for our network activities at the Paget, and we've managed to get some admin dedicated to our network and things. I think it's so important that yeah, organisations support and value staff network groups across equality and diversity, and I think that's definitely getting higher on the agenda, particularly in NHS trusts. So I think that's a positive across networks.
Great. I think you're right. I think the actual positive reaction that we've got from the board has actually helped greatly with this, and the actual fact that the NSFT, and I'm glad to hear that the James Paget board do want to actually, it's as though that if you take a step outside, the whole of community seems to be trying to batter you, you know. But then if you actually take a step inside, there's so much support coming. What I'm really amazed in is the guest speakers I have asked. I tried to have a balance. The start of the week was basically a trans social media influence, and the end of the week was is Camilla, who's actually going to be involved in setting up the GRCs, but they're also trans. And so I thought I'd then dot the rest, if you know what I mean. So I would not flood this actual this conference with all just trans stuff. That was one thing I did not want to do. I'm very what do you call it, very aware that I'm trans, and I don't want that to actually do anything. But what I'm really happy is you've had people like Paul Giluli and Michael Brady. Basically the first things they're mentioning, and even Lawrence, the first thing they mentioned is the actual attitudes about trans people at the moment, you know, and that really has filled me my heart, because I do look at the moment. I've said that I hardly know how to use Twitter, but I do actually look at it. It's on my desktop, so I can't I can't cope with it on a phone because I'm too much of a Luddite. But I do look, and it is extremely depressing if you fall down the Twitter rabbit hole if you're trans. And so when you actually hear guest speakers basically saying, we're aware of this, and especially guest speakers that are doctors in the NHS, we're aware of this, and we're actually pointing it out, and we are wanting to rectify this to actually stop. I think that is a stunning indictment of how the actual NHS wants to move forward. And I think you saying, Emily, that the James Paget panel are giving you support, and the board for NST are giving me support, I think is most probably one of the most positive things we can actually do. I really do think that is one of the most actual positive things we can actually do. And I'm going to close here because I'm really getting emotional. If you look in the actual columns of what the moderator Sammy's put down, she's put a link to forums. If you're watching, it's kind of a feedback form. We are going to be blanket emailing people, but if you actually fill it in now, we won't be sending you an email later on. So if people can fill that in, we'd be eternally grateful. If people can go on the forum and actually start discussions, we'd be what do you call it, eternally grateful. With a lot of love, can I thank Emily for joining us. Can I also thank Carn for joining us and Jess for joining us. Love to you all, and with a lot of love, can I thank Sammy, because she's done a marvellous job producing us. Thank you, and that's it.